Sciatic nerve, it is the thickest nerve present in the body. It is one of the terminal branches of the sacral plexus. Root value. It has two components, tibial component and peroneal component. So the root value for the tibial component is ventral division of anterior primary rami of L4, L5, S1, S2 and S3 spinal nerves. The root value for the peroneal component is dorsal division of L4, L5, S1 and S2 spinal nerves. So the tibial component, ventral division of L4 to S3, the peroneal component, dorsal division of L4 to S2 spinal nerves. Course. The nerve starts in the pelvis in front of the piriformis. It exits the pelvis by passing through the greater sciatic notch where it enters the gluteal region and descends in the posterior compartment of the thigh, that is the hamstring compartment of the thigh. At the junction of upper 2/3 and lower 1/3 of the thigh, the sciatic nerve divides into tibial nerve and common peroneal nerve. So the division takes place at the junction of upper 2/3 and lower 1/3 of the thigh. Relations. Anteriorly it is related to number 1, superior gemellus, number 2, obturator internus, number 3, inferior gemellus, number 4, quadratus femoris, number 5, adductor magnus. So above the tendon of obturator internus, the superior gemellus is present. Below the tendon of obturator internus, the inferior gemellus is present. Posterior relations. Number 1, piriformis. Number 2, gluteus maximus. Number 3, long head of biceps femoris. Long head of biceps femoris. So this forms the posterior relation of the sciatic nerve. Branches and distribution. So there are two components in the sciatic nerve, tibial component and common peroneal. From the main branch, main trunk, the sciatic nerve gives an articular branch to hip joint. So articular branch to the hip joint is from the main trunk. Number 2, muscular branches. The tibial component gives muscular branches to hamstring muscles, that is number 1, semitendinosus, number 2, semimembranosus, number 3, long head of biceps femoris, number 4, hamstring part of the adductor magnus. The peroneal component of the sciatic nerve gives muscular branch to short head of biceps femoris. Variations. The sciatic nerve, instead of dividing into tibial and common peroneal nerve at the junction of upper 2/3 and lower 1/3 of the thigh, sometimes the division takes place in the pelvic region. So in such cases, the tibial component emerges near the lower margin of the piriformis and the common peroneal component either pierces the piriformis or comes out on the upper border of the piriformis. Applied anatomy. Number 1, sciatica. It is a condition in which there is a shooting pain along the course of the sciatic nerve in the posterior aspect of the thigh due to pressure or irritation of the roots of the sciatic nerve. Slipping foot. The sciatic nerve is exposed between the gluteus maximus and the longus biceps femoris. It is not covered by the muscular structures. So when there is a compression or pressure on the sciatic nerve at this point, so the sciatic nerve is compressed towards the femur. This results in temporary sensory loss or paresthesia of the lower limb. This condition is known as sleeping foot.